So thank you for inviting me today. My name is Bláithín Moriarty and I'm a dermatologist in Vincent's in Dublin. And I'm going to talk to you a little bit about your skin in the context of all malignancies. Now, it's quite a broad field. In fact, there are whole departments across the world dedicated to your skin's reaction to having cancer or having cancer treatment. So I'm not going to try and touch on everything, but I'm going to try and give a structure to it. And please do ask any questions that you'd like. So first of all, I just want to tell you about what I do. So I'm a hospital-based consultant, and in dermatology, we look after diseases of skin, hair, and nails. And of course, we also look after diseases of mucous membranes, so a little bit of lips, mouth, genital, that sort of thing. And so in fact, we see side effects of cancer and of cancer treatment in all of these areas, so skin, hair, and nails. I'll talk a little bit about that. The majority of patients coming to our department are referred for suspected skin cancer. So in fact, some of our patients will start with us and then we'll move on to treatment of a skin cancer. So we have both sides of this coin. And then there's this huge field of what's called oncodermatology or cutaneous oncology, where we will treat side effects of cancer or side effects of cancer treatment within our department. And we are one of the departments in the country that takes a very proactive approach to this. So first of all, just a little plug for skin cancer rates, because of course, skin cancer is by far the most frequent cancer in Ireland. And so I don't know if a number of you listening may be skin cancer patients, and so that might be maybe why you're attending. So about a third of all cancers in Ireland are skin cancer. Now, fortunately for the majority of patients, this can be treated with a minor surgical procedure rather than radiation or immunotherapy or chemotherapy, which many people on this call may be going through. But a small subset of our more advanced cancers, patients will need these treatments. So about every 10 minutes, there's a new cancer in Ireland, as we know. So why do we have such high skin cancer rates? So first of all, we have very fair skin because we have effectively a genetic defect. So about 75% of us in Ireland carry a mutation, so a change in a gene called MC1R, which changes the color. So it changes the color of our hair and skin. And so, as we know, we have quite a lot of very fair-skinned people to look at in Ireland. But actually, even those of us who don't have very fair hair or fair skin or freckly actually carry this, and this predisposes us to skin cancers, so melanoma and other cancers. In Ireland, we've been very late to adopt sun protection behaviours. So for example, in Australia, it's been about 40 years since they've adopted protection from the sun. So those of you who have family or have lived in Australia will know that, for example, children aren't allowed outdoors in school if they don't have hats and sunscreen and sunglasses. But of course, this is something that in fact has only been officially launched in Ireland since 2019, but it's not something that has been to the forefront of our sort of national social behaviour or of our individual behaviour for most people. So it's a relatively new thing in Ireland. And of course, people say, well, we don't get that much sun in Ireland compared to somewhere like Australia. But the issue is that we get intermittent fleeting sun. So we're all familiar with the days where we leave the house needing an umbrella, and by lunchtime we need, a sun hat, and then 2 minutes later it's raining again. And so we tend not to be prepared for sun to the same degree because we're often not expecting it. So the SunSmart campaign was launched in 2019, and this is very pertinent because not only for patients, we're all at risk of getting a skin cancer, but you'll see as we chat along today that a lot of treatments for any cancer, so radiation, immunotherapy, a number of chemotherapy drugs, they'll induce if you combine those with UV radiation, so if you go out for a walk, which is wonderful and so important, and gosh, one of the key things to do when life is tough, if you can, to get out in some fresh air. But actually, UV exposure combined with a number of cancer treatments will cause skin pigmentary change. So sometimes people find that their whole skin changes color quite a bit, or it may predispose them to even further, make them a little bit more susceptible to skin cancers. So the SunSmart campaign was launched in 2019. So this is an Irish Cancer Society, Healthy Ireland, NCCP, HSE initiative. And so one of the things we'll talk about are the UV index levels. So you'll have heard in the media over the past number of weeks and months that if the UV index is above 3, then we should all be taking sun protection measures. But anyway, on to the more pertinent part of the talk. So we're going to talk about skin cancer about your skin, hair, and nails before, during, and after after cancer treatment. And I'm going to take a very broad approach, so please do ask any specific questions as you like. So this is what we call a dermatoscope. So this is a little device that we use for examining skin, and many of you who have been to dermatology will have seen these being used. So what do we do? So, unsurprisingly, no matter what the location within your body or what the type of the cancer is, in fact, before you're even diagnosed with the cancer, you may have noticed changes in your skin, in your hair, or in your nails. There's a whole science dedicated to disease-specific rashes. So, for example, some malignancies or some cancers that secrete different hormones may cause specific rashes. Some, for example, pancreatic cancers can cause specific rashes. And so there are certain rashes that we see that when we see them, we think, oh, should we be looking for a oropharyngeal lesion, or should we be looking for a specific cancer? I won't go into those in detail, much fascinating as they are, but if anybody has had experience of that, I'm delighted to hear of it. But what many people do notice is as part of, and not of course a lot of people may feel totally well, but in someone who's been feeling a little bit unwell before their diagnosis, they may have noticed their skin may have become very, very dry. And I don't mean sort of having had a beach holiday and forgotten your moisturizer. I mean really generalized, what we would call xerosis, or dryness, requiring huge quantities of moisturizer. And the other thing that sometimes people will get is their skin may look normal, but it may feel terribly itchy. So you can get an itch, and sometimes peculiarly this itch can actually be more prominent with water exposure. So for example, certain types of lymphoma, we'll have patients come to us and they'll feel well, they don't know they have lymphoma, they say, every shower I become incredibly itchy. Now, of course, some very hot water will make anyone itchy, but this is a very peculiar thing. People say it's never happened to me before, but in the last 2 weeks, 3 weeks, 4 weeks, 2 weeks, 2, 3, 4 months, when I have a shower, I become very itchy. And so that's a peculiar finding that we'll sometimes see and would prompt us to actually look for an internal malignancy. Hair is a peculiar thing, and so you will have noticed during your treatment, no doubt, that when you're feeling run down and medics are making you run down various different treatments, or it may become more dry. So this is separate to the huge hair fall that you get with a specific treatment, but actually your hair is quite sensitive to illness. And so during the pandemic, we've noticed that people who have COVID or even COVID vaccines will sometimes get a huge increase in hair fall, and their hair will get thinner. And having an undiagnosed malignancy will sometimes do that. So people will come and they'll say, I was totally well, and now my hair is suddenly begun to thin, and we'll say, well, go through a whole system, and are you anything else that you're feeling? And sometimes that can be an indication of an internal malignancy. And nails are also very sensitive to internal wellness. And so this is a picture of something called Bow's line. And some people, when they've had a very traumatic event, they'll get these lines in their nails. And I don't mean traumatic, of course, having a cancer diagnosis is emotionally traumatic, but I actually mean physically traumatic. So, having a sudden illness, sometimes your nails will change and you get these very specific findings. Now, of course, the benefit is hindsight is great for all of these things, and some of you may have noticed them, and many more people have had absolutely no changes. But these are things that we sometimes think about in patients who present without it. But we're moving on. So I'm assuming that most people who are coming to this meeting are doing so because they have a diagnosis and they're either about to start treatment, they're on treatment, they may be cycling through lots of different treatments, or hopefully for some of you, you're out the other end and no longer in need of treatment. But what can you do if you know you're about to start treatment? Well, as I said, we're going to take it in terms of skin, hair, and nails. Okay, so in terms of your skin, be gentle. Okay, so many of the treatments that are used for any other malignancy, in fact, will impact on your skin. So I would say be careful in the sun, and we'll talk a little bit about sun protection in a minute or two. But it's now more than ever, protect your skin from UV radiation, okay? Because many of the treatments that you may require may sensitize you to UV radiation. Keep your skin as well moisturized as is practical. I don't mean go out and buy the most expensive moisturizer you can find. Many of them are reimbursed, on prescription. So if you're getting a prescription from your GP, things like Silcox Base or Epiderm Cream, very bland, come in 500-gram tubs and are reimbursed, are really good moisturizers. And it's not the time that you need to run out and buy very expensive things, because as we all know, unfortunately, being ill is a very expensive activity. And this is not, and skin is not something you need to spend a fortune on. Generally, try and stay away from fragrance things. If you do get gifts of beautiful fragrance creams, try and keep them for special occasions, because actually the very bland moisturizers are often less irritating if your skin does suddenly run into trouble because of another treatment. In terms of your hair, and of course there's a wide variation in people's hair's response to treatment depending on what you get. Keep your hair in as good condition as you can. So as much as possible, people will talk to you a lot about diet. Do try and maintain a balanced diet in terms of your hair. So things like iron and zinc are really important to maintain your hair. And keeping your hair in good condition. So I just mean keeping it, feeding it a good diet, and keeping it as not doing too many procedures on it in terms of straightening or coloring is probably worthwhile. So just keep it really well moisturized if you can. Nails are sometimes the forgotten feature of this, and so nails are often also affected by cancer treatment, even if the treatment isn't directed at the nails. So you may be having a chemotherapy or systemic chemotherapy or radiation elsewhere, and your nails may actually start to react to it. And we'll talk a bit about that, but where possible, try and avoid traumatizing them. And by that, I mean gel nails or shellac nails or false nails. Try and just keep your nails as they are. Normal polish is fine. Try not to use too much acetone on them. But that's what I mean by trauma. And then maintain the cuticle. So if you are having a manicure, which is a really nice way to spend an hour, don't allow them to trim your cuticle if you don't mind. Just keep the cuticle, because what happens is that you can get a little bit of water in around the sides of your nails, and as your immune system dips with treatment, you may find that you get infections or what's called paronychia around your nails. So I would get into the habit of buying, again, a very inexpensive, very bland hand moisturizer, something like a Neutrogena hand cream that's unfragranced. Keep it in your car or your kitchen, next to the kitchen sink, and a few times a day, put some moisturizer in your hands, and that can maintain your cuticle. And it won't necessarily put running into trouble down the line, but it does get them into as good a condition as possible before the onslaught of whatever you may need to endure in terms of treating your cancer. I'm going to talk a bit about photoprotection. So we talk about photoprotection rather than sun protection, because by photo we mean light. And this is a photograph that I hope projects well to you, but it's taken from the Australian SunSmart campaign, and it shows the various different features of protecting your skin from UV. So we talk a lot about sunscreen, and sunscreen is really important, but sunscreen is only one aspect of protecting your skin from UV light. And you see these people are sitting in the shade. I'm sorry for being pedantic about this, but they're sitting in the shade. They have umbrellas. They have hats on, because and between the shade and the hat, you will reduce the UV radiation that you're exposed to by about 70%. But you still get a 30% as much UV in the shade as you do in the bright light. So don't forget that, because you're not in the dark, you're just in the shade. So hats, shade. You see this guy's wearing his sunglasses to protect his retinae. And then the other thing, of course, is to stay indoors between 12 and 2 if it's very sunny, And then for areas that you can't cover, we're going to talk a little bit about sunscreen. These are two resources for sunscreen if you have, because there's an awful lot of chat. And I think sometimes when people say be extra careful of your skin in the sun, it prompts, we all panic a little bit and sort of say, well, what does that mean? And it doesn't, it's not rocket science. The key thing for finding a sun cream is to find a sun cream that you like, because if you don't like it, you can't use it. So that's the most important thing. Okay. Broadly speaking, creams work a little better than lotions or oils or sprays or milks. So broadly speaking, cream is the best. If you're going to put on a sun cream, if you're going to go to the bother, I would put on an SPF 50 or above. 30 is adequate. However, when you put on the sun cream, you need to put on 2 grams per centimeter squared in order to get the SPF in the bottle. Sun cream on, that's a huge amount of sun cream. That's about 4 times as much sun cream as the average person, and this has been studied, uses. So none of us get the SPF on our skin that it says on the bottle. So I would argue that if you're going to put on any sun cream, put on the highest when you can. Okay. The SPF refers to UVB, so that's the UVB radiation it's blocking. We now know that UVA is also very important, and it's particularly important for pigmentation. So some of you will notice that by the time you've made it, and hopefully successfully through your cancer treatment, that your skin looks a lot more tanned than it did before you started. So quite a number of treatments will cause hyperpigmentation of your skin, or brownness of your skin, more so than usual. And to an extent, that is one of the least worst. We take that if you get out the other end well and cured. However, if it happens in an uneven fashion, it can be very distasteful for patients. And these are the sort of thing that at the start of the treatment you think, gosh, that wouldn't bother me at all. But actually, when you successfully come out at the end, some people do find that quite bothersome. So I would be careful of UVA as well as UVB when you're having cancer treatment. So sun creams now usually come with they either say broad spectrum, or they might say 4 or 5 star UVA. And I would choose something that says that as well. Okay. These are a selection of very good sun creams. This is not an exhaustive list. There are absolutely tons of very good sun creams on the market. Okay. Kids ones often are less irritating if your skin is sensitive. So that's why I put a kids one on here. Of course, it's a very good brand. Altruist is a brand that is superb, and one of the reasons I like it is that it is much less expensive than many of the other brands. And so unfortunately you can only get it really on Amazon. There is a pharmacy in Hove, I know, that stocks it, but it's tricky to get. But this is a lot less expensive than many of its competitors, and it is just as good, if not better, than many of them. It has a newish titanium block in it that works very well. So as I say, I know how expensive it is to be unwell. So this is a time that great, again, I don't mean to patronize, but you don't need to be spending a fortune on your skin. Inexpensive products are just as good, if not better, a lot of the time than the top of the price range ones. There can be a bit of a debate about chemical or physical sunscreens. So chemical sunscreens, for the most part, absorb UV light, and physical sunscreens reflect some of it. So there's a bit of overlap. We know that physical sunscreens actually absorb some UV light. They don't reflect at all. But the traditional sort of zinc or titanium sunblocks, where you would have seen sailors with blue noses because they had put zinc on their noses, that's a physical block. Those filters are now transparent. So there are a number of physical sunscreens on the market, including this one, where the block is physical, but it's now transparent, so you don't have to go around with a painted white, blue, pink, green face as you used to back in the 80s. But the most important thing, as I say, is that you like it. So apologies for dwelling so long on sunscreen choice, but I know it's one of these things that often people will get you can get bogged down in, and there isn't one perfect sunscreen. The perfect sunscreen for you is the one that you like, that doesn't sting your eyes, that doesn't stain your clothes, that doesn't cost a fortune, and that you like the smell of and the texture. So that's just a little bit on sunscreen. So that's your skin. For your hair, again, it's the same thing. Some people feel well starting treatment, some people don't feel so well starting treatment. And so, whatever you can do to maintain your diet to protect your hair, great. It's the same diet that you would have for any other part of your body. So, a broad, balanced diet. iron, zinc, these minerals will help to maintain your hair in good condition, but you don't need to do something different to what you're doing for the rest of your body. Again, for your nails, avoid trauma, so no gel nails, and maintain your cuticles. So what might happen during a treatment? Well, I've pulled this diagram here, which is if you were to imagine that you slice down into your skin, it shows what your skin looks like when you slice down, and this is what we look at down the microscope when we take biopsies of skin. So you can see that, and the reason I've put this here is that I wanted to talk a little bit about the functions of your skin. So we know that your skin is there to keep everything in place. It has a barrier function, so it protects everyone from onslaught, from things getting into your body. But as well as that, it has a number of immune functions. So if you look here, there are, do I have a pointer? There are lymphatic vessels, there are veins and arteries. There are sweat glands, and a lot of treatments are actually secreted by these sweat glands out your pores, and so that's a direct toxic effect of some chemotherapy agents on your skins, and that can be what dries it out, and that can be what causes different issues with your skin. So for all the moisturizing and all the sunscreen in the world, a percentage of people will still run into trouble with their skin regardless of what good care you take. If you know what good care you're up to and able to take it. So there are a number of different, this is the muscle fiber and it's the hair fibers. There are lots of different functions of your skin. So not only does it have a barrier effect, which is really important to maintain if we can, it also has an immune effect. So during your cancer treatment, you may have surgery, you may have chemotherapy, you may have immunotherapy, you may have radiation, and you may have more niche treatments. There are a number of specific rashes that we see. So certain drugs will cause certain rashes. Okay, I'm not going to go into those in detail because there are too many. Okay, and different regimes we know will cause specific problems. But broadly speaking, in terms of surgery, what might happen to your skin, hair, and nails? Well, in terms of surgery, this is a big physical trauma. And often you end up having things like intravenous lines, bloods being taken, dressings being put on, and all of those irritate your skin. Okay, so being in hospital dries your skin out. The air, as you know, is quite dry and often very warm, and even just working in a hospital dries your skin out. So being a patient in a hospital is really, really tough going on your skin. So if you have surgery, often the dressings will irritate the skin, so you might find that around the wound, the skin gets red. And sometimes that will go away with a bland moisturizer, like we talked about, something like Silcox base, Holland's base, Epiderm cream. These are all reimbursed creams that I'm talking about. There are a multitude of other ones, but I don't want anyone to spend a fortune. And so keeping your skin really well moisturized will do a couple of things. It will maintain this barrier, and that reduces the inflammation that you get. But sometimes you need some topical steroids. So sometimes you'll need, some of you may have heard of things like Betinavate or Humavate. Sometimes the irritation that you get from dressings or other variety of sticky things that are put on your skin in the hospital will require topical steroid. Chemotherapy can have a number of different effects. And so a number of chemotherapy drugs, most famously probably the EGFR blockers, so things like cetuximab that's often used for bowel cancer, will cause a specific rash where you get a facial rash, and that can be very distressing to have. Although the flip side of it is that we know it's associated with a better outcome. So we want to manage the rash, but also we're usually slightly pleased when we see it, because it's statistically more likely that patient will do well from their treatment. Doesn't mean you do badly if you don't get it, but there are some specific rashes that we see with different treatments. Immunotherapy is a relatively new form of treatment, and I know that Dr. Bird is talking about this at the moment, but we see a huge number of patients with skin reactions to immunotherapy. Partly, a lot of the pathways that are being blocked by immunotherapy are skin particular pathways. So if we're treating, for example, melanoma or squamous cell carcinoma, we now use immunotherapy. So that's no surprise then that if you're having immunotherapy for another cancer, that it may have an impact on your skin. But we know that about 80% of patients who get immunotherapy have some form of skin side effect. We also know that if you have a reaction to your treatment and you're a cancer patient, that if you have a skin reaction, often the oncologist will say, oh, well, gosh, I'm not quite sure what that is. Let's hold the dose. Let's call derm. And we know that the earlier that you get seen by dermatology, or the earlier your rash gets treated, the fewer delays in dosing you'll have, the fewer reductions in dosing you'll have, and that may be associated with better outcome in some cases. So it's just something aware of. If you see a rash, radiation almost always causes a skin reaction, and I have some resources at the end of this to talk about for you to look up, but your radiation oncologist, if you're having radiotherapy, will almost always talk to you in detail about the skin reaction that you'll get from radiotherapy. Not everyone gets it, but a lot of people do, and really using a good moisturizer is really important for that. So what can you do? Okay, so the pH of your skin is usually around 5, so somewhere between 4.5 and 5.5. Soap has a pH of 8. So if you use standard soap on your skin, what can happen is that you can break up this barrier. The skin barrier can get disrupted by the soap. So if you can, and particularly if your skin is sensitive, use a foaming or a liquid cleanser that has a pH of around 5. Okay, and that's the only thing really that I would suggest, particularly if you're getting facial sensitivity, that I would suggest doing, is to swap out your soap for a low pH. Unfortunately, these often retail between about 10 and 20 euros. So I would normally suggest to patients who don't have sensitive skin in particular only to use them on their face. There are a number of good brands, and there are a number of brands, including La Roche-Posay, Cetaphil, CeraVe, where they will specifically market their product for patients having chemotherapy, and they come in at around 12 euros or so, which I know doesn't sound like that much as a once-off, but I realize how these costs mount up. So if your skin is very sensitive, that is one top tip: pH of around 5. Sun protection again, and a moisturizer. Keep your hair in as good condition as you can. Of course, a number of agents will cause hair fall, and so you may find that no matter what you do, your hair falls out. And if anyone has any questions about hair loss, I'd be delighted to specifically address those. Again, maintain your nails in good condition. And the key thing is to ask. Okay, so your oncology nurses, your oncology specialist nurses, your medical team, your GP, your Daffodil Centre, the Irish Skin Foundation, you could call dermatology if it's available, all want to be asked. So we come across these questions day in, day out. And often patients will have not noticed they're happening or not felt they were important enough to bring up. But if you do start to find any changes, do ask, because we're delighted to hear from you, and we know that it will make your journey less unpleasant, and we want to do everything we can to ease that. So these are some resources, and I'm going to leave them here and on a later slide, because I do want everyone to be aware of the resources that are available and to have access to them and others. So after treatment, what happens now? Does your skin go back to normal? Does your hair go back to normal? Will your nails go back to normal? Well, unfortunately, we all have to pretty much wait and see. So after you've finished treatment for your cancer, often your skin will remain very dry, and it will remain a little bit darker than it was before you started. And that's a frequent finding. That usually peters out over time, but keep going with the sun protection, keep going with the moisturizer, particularly for maintenance or your switching regime. Oddly enough, sometimes people's hair comes back even better than it was before they started. And some people who started out with straight hair will end up with curly hair. So you may find that your hair comes back, but it comes back differently to how it was before. We know, unfortunately, from the taxane story that not everybody who loses all their hair will get back all their hair. Although, of course, cold caps have changed that considerably for the majority of women, tricky as they are to maintain. And then again with your nails will be soft after you're finished treatment. And for most people, they'll find like little lines, little linear ridges down their nails. And if that's you, again, keep going with the avoiding trauma. Don't be tempted to cover them up with gel nails until you're past your chemotherapy for about sort of 9 or 12 months, because that will weaken them further. But the good news is that most people's hair, skin and nails comes back to how it was, or version of how it was when all is said and done. So I'm going to leave you here with these resources. I hope I'm on time, I think, and I'm very grateful to be invited to speak today. I hope that jogs or prompts you to think of things as you go through treatment. I know it's not answering specific questions, but of course, there's sort of so many that it would be difficult to address every specific drug in one go. But I really want to get you into the mindset of thinking, what very small and inexpensive thing can I do to make myself feel better physically in terms of my skin, to keep my skin in good condition, and just to prompt you to think as you're going through your treatment, if you find a change in your skin, hair, and nails, please ask. Please ask. We know that it will make your life easier, and it's often a very easy thing for us to answer on our side, and a more challenging for you to find out on yours. So please do ask. Thank you.
Hi there. Hello, everyone. I'm Zahika Shah, and thank you so much, Bláithín. That was such an informative session. If you, all the viewers, if you have any questions, please pop them in the chat box, and then we'll ask Dr. Bláithín all those questions. Oh,
what have I done? I've shared you multiple times.
you can stop sharing. Yeah.
There we go. Stop sharing. There we go.
Yeah. Perfect. Here we have it. Let me kick off the session with one of the questions. So, I would say, like, how often should we check our skin for the changes? Like, is there any timeline?
Well, I know that's a tricky one, because I suppose the key thing is that, as you know, going through cancer treatment, as we know, is a shifting sand, and so we'll all start out with a definite plan to do things at fixed intervals. But of course, things happen, things go better than expected, things have take unexpected changes in course. So the first thing, I suppose, is to say not to beat yourself up about looking. But if I would get into the habit of moisturizing your skin, just, well, I would say every night before you go to bed. Nobody does anything every night, but if that's to add it to your regime, to have an inexpensive moisturizer that goes everywhere in your body, and that we put on every night if you can, or every time you get out of the shower if you can. That will be a start. And if you start to notice anything in your skin, that's when I would check. So I wouldn't add skin as an extra task to your to-do list in an already difficult time.
Absolutely, yeah, that's quite helpful. I would also want to ask you, like, if someone has moles on their body, and we are mostly told that if you have a mole that's changing or a new mole appearing, that's cancer. Is that always the case?
So if you have a new mole, if you develop a new mole after the age of about 35, or if you have a changing mole, particularly one that's changing quickly, so in weeks to short months, and asymmetrically, and that's getting larger or darker, that definitely should prompt a review.
Okay.
Actually, though, I would say, if we take 100 patients who make it to us, so they've gone to their GP, they've been referred into the rapid access clinic, and they see us, probably about 3 to 5 of those changing moles will be a melanoma. And actually, some of them might be a little unusual. They might have started to change, but they're not actually cancerous. And the majority of them will be benign. So having a changing mole doesn't necessarily mean that it's cancer. And particularly some immune treatments can, because they treat melanoma, you may see changes in your skin, you may see changes in your moles. And of course, if you're having to have big doses of steroids and your weight is going up and down, that may stretch out moles. So it's an anxious time. And certainly if there's anything that you think is changing, we're delighted to see people. But I wouldn't automatically assume that it's going to be something really awful. Because I know when you've had something really awful, like a cancer diagnosis, we also sort of change our mindset to think, gosh, everything's going to be really awful. But for the majority of the time, actually, they're going to be okay. Most of the time. But they should prompt review. Yeah.
That's so true. Just a review is important. We have a few questions here. Neve is asking, is there anything that can be done if hair did not fully return after chemo?
So yes, and I would seek advice on that. So in the first instance, if you have some hair regrowth and it's early and you're off treatment, something like Regain can be useful, and you can get that over the counter. So Regain is a Rogaine, or it's now generic, so you don't have to buy the branded version, is 5% minoxidil foam. And you can get that in a generic, so it's much less expensive than Regain. Using that at night for 6 months in about a third of people will really improve their hair growth substantially. For some people, it's just time. Some people, unfortunately, their hair won't regrow adequately. And the taxane story, or initially, people, the thought process was that everyone got their hair back, and now we know that that's unfortunately not the case. The majority of people do, the vast majority. But there are other options in terms of treatment or of camouflage. So I would try Regain, and I would, while you're trying that, I would seek advice, particularly if you have a dermatologist local to you who has expertise in hair.
Thank you so much. That was very helpful. In fact, the fact that you emphasize on inexpensive products is so helpful as well, because normally we think that the most expensive product is the best product available.
Yeah, it is. And it's actually something we see a lot of. So often by the time people come to us, they'll have spent a fortune, because you kind of think, oh, skin, I'll just treat it myself. And often people will come in and they'll have spent, like, I don't say wasted. A lot of these things are very nice, but they'll have spent a lot of money before they make it to us. And often it's, if it's not quite the right thing, it's a lot of money that could have been spent, in another way. So
Absolutely.
So don't let the marketing draw you in.
That's so good. Yeah. So we have a question again from Joyce, and the question is: I have blotchy skin since my chemo, like white freckles. Is there anything I can do about them?
So it's tricky to know exactly what it is, but you can sometimes, some treatments will induce something called vitiligo, which normally is an autoimmune process where people lose the color in their skin. Sometimes it's not that, though. There's a variety of other things that can cause white blotches, but that may repigment as time goes on, depending on how long out from your treatment you are, and that may settle itself. If you're very fair skinned, I would camouflage it, so things like false tans. If you have darker skin, so skin color is divided in 1 to 6, so if you've type 4, 5, 6 skin, so dark Mediterranean, brown or black skin, there are treatments that you can use. For example, you do have it delivered by a hospital, don't go to a sunbed, that might that can lead to repigmentation. So if it's not settling and you're 6 to 12 months out, again, that is something that may be treatable. So I would have someone see if they can have a look at that for you.
Perfect. Thank you so much. Getting about the color of the skin, I have a question there. Like, are skin cancers common amongst people with darker skin color? And do they have to take all the precautions that you were talking about as well?
So this is a huge debate. So there's a dermatologist in the US called Addy Adamson. I don't know if you've come across him, and he is a gentleman with skin of color, and he is hugely against people with skin of color being told to use protection from UV because of the risk of vitamin D deficiency. And of course, that's something that we all worry about, and we know that replacing vitamin D orally doesn't have the same benefit as having an innate vitamin D store. And of course, having worked in places with patients with lots of skin color and very little sunshine, so for example in London we would see kids coming in with rickets because their vitamin D levels were so low. So certainly we do not see as much UV induced skin cancer, and 90% of skin cancer is induced by UV, 10% is not. So of the UV induced cancers, we do not see as much in skin of color. It's much less lesser rate, and the types that we do see are in equal frequency. So for example, melanoma of the palm and sole, or cutaneous lymphoma, these are not UV induced cancers. So certainly be careful with your skin. But in terms of the UV induced skin cancer risk is much lower. Now I would say that in skin of color, UVA induces far more pigmentation than pale skin. Okay, so if you've got what we call type 1 or 2, so red hair, freckly skin, UVA doesn't do as much damage as it does in type sort of 5, 6 skin, where it induces quite a bit of pigmentation. So if you're having a cancer treatment that makes you susceptible to hyperpigmentation, then I would be careful of the UV, not as much because of the skin cancer risk, but just because when you get out the other end and you want to celebrate, it can be very distressing, and it sounds trite at the start of treatment, but often it's distressing at the end of treatment if you have dyspigmentation of your skin.
Thank you so much. That was so informative. Thank you. Probably Oh, we don't have any questions here then. Um,
Perfect.
any closing comments for everybody then?
No, well, I would just, like to say that we in dermatology are always very keen to be asked. So, and that's they're the two things that I would take, or the three things I would take away is: one, don't spend a fortune before you get advice. Two is do ask, and often asking about your skin can seem, it can seem superficial when you're, if you don't mind the joke, when you're going through something really terrible, but often it's the little things around the edge that will really make life that bit more tricky. So so do ask. We want to be asked, and often it's a 2-second answer for us because we've seen it before, and it may not be for you. And then the last thing I would say is just be easy on yourself. Don't spend a fortune on it.
Thank you so much, Dr. Bláithín. This was such an
Thanks.
incredible session. We really, really appreciate your time.
Not
Thank
sure.
you.
And likewise, and thank you for asking me, and good luck, everyone. Bye-bye.
Bye-bye. Take care, everyone.